This video is observational documentary and not medical advice. So today we'd like to talk a little bit about ulcerative colitis and sort of the pathophysiology and presentation of, and try to get some understanding of what ulcerative colitis really is. So ulcerative colitis is a relapsing disease of the large intestine. It's really of unknown origin, although we know that there is an autoimmune component with ulcerative colitis. It's questionable that there may be some vitamin D deficiency issues, as it seems to be more prevalent in the northern hemisphere than in the southern hemisphere. And also, we know that there is possibly a genetic component, because if you have a first-degree sibling or parent with ulcerative colitis, your odds of getting or passing on that gene have been shown in the research to be about 25%. So ulcerative colitis, inflammation of the large intestine, usually limited, well, it is limited to the colon, the inflammation. Different than Crohn's disease, which we're not discussing today, but it is part of the inflammatory bowel disease, not to be confused with irritable bowel syndrome, which we are also not discussing. So ulcerative colitis, chronic inflammation of the colon starting in the rectum down here, and this would be the anus here coming out. Chronic inflammation, okay, usually starting here and then moving proximally around sigmoid, descending, transverse, ascending colon, and then the terminal ileum, which can have some involvement, but it's usually not significant. So we know, according to research, that we have usually folks that have some ulcerative colitis have autoantibodies, IgG antibodies in the blood, and as well as in the colon. Your T cells, which are lymphocytes, which is part of your immune system, that normally fight off infections for you in foreign types of bacteria or viruses that normally protect you. Maybe looking at the colon as a foreign body and attacking it and causing inflammation. The T cell lymphocytes, white blood cells, may be involved with inciting cell death in the colon and cell death of epithelial cells as well. As your colon is lined with mucosa and epithelia all the way around, and so if you have T cells and inflammatory factors, inciting inflammation along all this mucosa, which is made up of these epithelial cells in here, then you're going to get a lot of cell death. And when you have all that inflammation, you're also going to be releasing cytokines. So cytokines such as interleukin 1, interleukin 2, interleukin 6, interleukin 8, interleukin 10, tumor necrosis factor alpha, oxygen free radicals. You have macrophages also present at the site of inflammation, which are also white blood cells. They're going to be contributing cytokines, and those macrophages are going to be some of the responsibility for the fever that may be associated with severe disease. When we talk about manifestations of ulcerative colitis, you're going to get mucosal lesions from the inflammation that we discussed. The tissue is going to become edematous. It's going to be dark red. It's going to be very friable tissue. It's going to lead to bleeding and erosion. And then there's possibly going to be a thickening and narrowing of the mucosa in the colon, and possibly the development of pseudopolyps in the colon from rapid regeneration of epithelial cells. So signs and symptoms. If you have ulcerative colitis, you probably have noted some of these. Diarrhea, bloody diarrhea with mucus, pain, abdominal pain, and cramping, severe disease or bleeding, severe disease. You may have fever, multiple stools. It's not unusual to have 10 to 20 stools a day, bloody mucousy diarrhea, severe urgency and incontinence, and that comes from the inflammation in the blood, and blood is a cathartic in the bowel and makes you have to go to the bathroom. Cramps in the belly. Yet very uncomfortable, absolutely uncomfortable. Some of the other symptoms that one might get are a decrease in your hemoglobin and your hematocrit. You might have a increased white blood cell count if you're in active severe disease. You may get hypovolemic from diarrhea and blood loss, meaning you don't have enough volume, blood volume. Malnourishment from rapid transit of food stuffs going through, vitamins and nutrients not being absorbed in the gut. Maybe just people aren't eating because they don't feel good, with the abdominal symptoms that we discussed earlier. Hemorrhoids from straining is quite common experience. You get that tenesmus. The medical term is tenesmus, or incomplete void, where you feel like you still have to go to the bathroom, but there's nothing coming out, caused by the inflammation. Very uncomfortable. Weight loss, probably from what we discussed above, the malnutrition, not eating. And then cancer from years of this possible complication from years of chronic inflammation. Inflammation is hard on the body. Of note, folks with ulcerative colitis may have some extraintestinal symptoms, as well as a myriad of autoimmune diseases that may cohabitate with the ulcerative colitis in a given individual. Not going to discuss all the autoimmune stuff that could go wrong with it, just a basic overview here. But less than 20% of folks with ulcerative colitis may have some extraintestinal symptoms such as polyarthritis, which migrate from joint to joint or tendon to tendon, sometimes peripherally. Some people may have central arthralgia in the spine, which can also be associated with another autoimmune disorder. Mouth ulcers, eye problems, gallbladder problems. These can all be present with ulcerative colitis. And we're going to stop our video there, and just being an overview and introduction to the pathophysiology of ulcerative colitis. Hopefully that helped anybody that was curious of why this disease may be occurring. Is a good introduction, and I hope that everybody has a great day. Thank you very much.